Hello, this is Rebecca Hergert. We're going to talk about asepsis and infection control. We've learned about this in Nursing 204. We're going to build on it and refresh ourselves somewhat because it's a very important concept. You're going to be using it throughout your nursing. Our objectives are going to be to define the concept of infection, to investigate the chain of infection, to analyze ways that we can prevent infection. We're going to talk about personal protective equipment. We're going to call it PPE just because it's easier, briefer, easier to remember. We're going to talk about PPE, when to wear it, and how to wear it. Okay, the concept of infection is talking about the invasion and multiplication of microorganisms in body tissues, which may be clinically unapparent or result in local cellular injury due to competitive metabolism, toxins, intracellular replications, or antigen-antibody responses. Terms that you're going to need to know that we're going to review are medical asepsis, the surgical asepsis, chain of infection, sterile technique, disinfection, sterilization, contamination, and we're going to talk about how we can implement a culture of safety. We're going to hit each of those as we go down through. Chain of infection, as you'll recall from 204, is you have an infectious microbe, you have a reservoir, a portal of exit, a mode of transmission, a portal of entry, and a susceptible host. If you break any of those links in that chain, you can prevent the infection. So we're going to talk about each link and how we can prevent that link from continuing on. That way we have multiple ways that we can prevent infection. To break the agent or the reservoir links, for the agent, you're just going to clean and disinfect everything. Sterilize it. We're going to get into more what those terms mean as we go, but for now you just need clean. When you clean it, you get rid of the bacteria, the viruses. The reservoir, you're going to control the sources. Where your fluid's coming from, is your drainage contained? You're going to wash your hands. That's a primary, tremendous, huge thing in nursing. Keep your patient clean. You need to bathe your patient. You can't let them go for their entire stay or even more than a day or two without making sure that they're clean. Keep your dressings changed as they should be. Keep your surfaces clean. And follow the agency policy for the solutions that you use to clean and how you're going to dispose of canisters whenever you're suctioning body fluids. To break the portal of exit, you're going to avoid talking, coughing, laughing. If you've got a wound open, you don't need to be doing those things. You need to be quiet or you need to be wearing a mask, because if you talk or if you cough or if you laugh over your sterile field, you just infected it. Wear a mask if you have a respiratory illness. Wear gloves if you're going to handle any kind of blood or body fluids, any chance that you're going to come in contact with feces or emesis. Gloves are your friends. Handle all lab specimens as if they're contaminated. In order to break the transmission link, again, you're going to wash your hands. You're going to avoid shaking the linens. And when you change the linens, remember we told you to just bunch them up and put them directly into the linen bag. You're not going to drop them on the floor because you just contaminated them more. When you dust, you're going to do it with a damp cloth. You're not just trying to spread the dust into the air, you're trying to collect it. Avoid contact of the linen with your uniform. You want to hold it out from you somewhat. Follow the standard precautions or isolation precautions. You always use standard precautions. We're going to talk about when you're going to put patients in isolation. And discard any item that touches the floor. If it touches the floor, it's bad. Break the portal of entry. You want to maintain your skin barrier. Maintain your mucous membranes. You want to keep those intact. You want to avoid any breaks in the skin. You need to turn and reposition your patient. If they lay in one position for too long, it makes them more likely to have a pressure ulcer. We're going to talk about that later in the semester, but for right now, just need to know every 1 to 2 hours you need to be turning your patients. You need to make sure that they have the opportunity to be clean. Offer them their hygiene if they're able to do it for themselves. Provide their hygiene if they're not able to do it themselves. Make sure wounds are covered and clean. Keep all drainage closed and intact. That's massively important. Anywhere your drainage goes, so does the bacteria. You're encouraging disease transmission rather than stopping it. Make sure that you get rid of all sharps appropriately. Many long years ago, they used to take sharps and stick them in the linens. Take them off and stick it down on the mattress until they got time to go throw it away. We don't ever do that anymore. As soon as you get that sharps off, as soon as you stop with that needle, you cover it and you pitch it. And it still has to go in the puncture-resistant containers. To break the chain at the host, you want to make sure that you provide adequate nutrition. The better nutrition they have, the better their immune system can work. If you don't have the materials to fight infection, you can't fight it. Ensure that they have adequate rest and provide proper immunization. If they have a vaccine out for something that they're susceptible to, they need to have gotten their vaccines. With children, you always want to make sure that they get their scheduled immunizations. If you get a chance to go on one of the overseas trips, you're going to need some additional immunizations more than likely, because some disease processes, some infections are more prevalent in certain areas than they are here. Whenever my son was deployed for the National Guard, he had to have an entire battery of immunizations for where they were going. Best offense, good defense. The body has normal flora, normal bacteria that's there. It's supposed to be there. It does good things for the body. And that flora is one of the body's first lines of defense. Clostridium difficile is a spore-borne bacteria that is very common when people have been on antibiotics for a while. So anytime someone comes in with diarrhea, one of the questions you ask them, have you been on any antibiotics lately? Because antibiotics kill bacteria. They don't know if it's supposed to be there or not. So it kills it, and then the Clostridium difficile, which is so much harder to kill, there are only a couple antibiotics that really work well against that. So it has a super infection. Now you've got way more than your body can handle. It causes the diarrhea, and it can cause some real trauma to your intestinal tract. The other defense mechanisms you have are the inflammatory response and your immune response. And if you haven't already learned about those in patho, you will. I'm not going to go into a lot of depth there, just a little bit. We're going to talk about the stages of infection. The early stages are the incubation period. Now this is after you've been infected, but you're probably not even showing symptoms right now. You've come in contact with a virus and or bacteria or whatever the agent is that's going to cause the problem. It's already in your body, it's multiplying, but you don't even know that you've got it. After the incubation page, you go into the prodromal stage. It's the most infective stage. You may be having some malaise, maybe some fatigue, just really don't feel great, but you're not overtly ill. You're just not really feeling wonderful. Therefore, you are infecting other people, and you don't even know that you're infected. That's why we don't want you at clinical if you're not feeling well, because you can infect the entire staff, the entire hospital, and you don't even know that you've got something. So keep your immune system, keep rested, keep your immune system, eat well. We don't want you to be sick, and we don't want you to make other people sick. Sometimes this can take several days, sometimes it can take a week, but usually you're not even aware that you're infectious. Later stages of infection, the next one is the full stage of illness. This is when you know that you're sick. All the signs and symptoms are full blown. If it's in one area, it's called a localized infection. If it's kind of throughout the body, it's called systemic. But this is when you and everybody around you knows that you're sick. And then the convalescence period is whenever the infection has been defeated and you're improving. It's a recovery period. It may completely resolve, it may leave some residual effects, or maybe recurrent. It may just keep coming back and coming back. Herpes simplex is like that. You get rid of the current outbreak, but it's always laying dormant, and anytime your immune system drops, anytime you get overly fatigued, you're under a lot of stress, it flares back up. Another type of infections are called hospital-acquired infection. You'll see them abbreviated as HAI. Also used to be called nosocomial. So if you see nosocomial infection, it means the same thing. And these are infections that you get while you're in the healthcare system. They're usually fairly virulent. They're pretty powerful because you've already tried to kill them, and they're resisting everything. So you do not want to get a hospital-acquired infection. They cost about $39 billion annually. Very hard to get rid of. It delays recovery. It increases the amount of treatment that you have to have. Delays the discharge. So we need to be very, very careful. That's why patient safety, hygiene, infection control, you're going to hear this pounded so much you're going to get bored with it, but it's really important, and this is one of the big reasons why. Very costly to everyone, not only in terms of time, but also in terms of the damage that it does to your body. Evidence-based practice, infection control measures are constantly updated. You always want to use the most evidence-based practice. You want to use infection control measures are always being updated. You always want to use the most recent guidelines, the most well-documented, most effective means of infection prevention. So you're going to keep up to date with your CDC, the National Guideline Clearinghouse, the National Institute of Health and Clinical Excellence, and you can go to the Cochrane Library where you can actually go and see what the research is. And I've given you all those websites that you can go and look at. Okay, quick check. I'm going to let you read this slide. The nurse is preparing to change the dressing from a wound draining thick yellow exudate. The nurse is aware that the dressing represents which link in the chain of infection. I want you to know that. Come back and tell me in class.